Well, hello, everyone. I'm Dr. Siddharth Sheth. I'm a medical oncologist at the University of North Carolina at Chapel Hill, and I specialize in head and neck and thyroid cancers.
Hi, my name is Kathryn Gold. I'm a physician and a medical oncologist at University of California, San Diego. Thanks so much for having me here today.
Well, great. It's so great to be here with Dr. Gold, and we'll be talking about head and neck cancer abstracts from the 2022 conference in Chicago. And I'll just say personally, it was really great to be back in person with all of our colleagues after a few years hiatus because of COVID. So, today we'll be discussing key selected abstracts that were relevant to head and neck cancer and really focusing in 4 sections. The first will be the curative setting. The second will be the recurrent metastatic setting. The third will be supportive care studies. And finally, the fourth will be biomarker studies. And so before we jump into that, I wanted to give a nod to our colleagues, particularly in Asia, who are doing all the wonderful research in nasopharynx cancer. And it's really been incredible amount of new data that's come out in a few years and has really taken kind of the lead at our head and neck conferences and other national conferences. And so I think we could just start there. And Dr. Gold, was there anything that you saw at ASCO that really excited you?
Yeah, I think for nasopharynx, there was some really interesting data out there. Nasopharyngeal cancer, it's not super common in the United States, but in parts of the world, especially in China, it's a very common malignancy. And the treatment is normally a combination of chemotherapy and radiation. We cure a lot of patients with that treatment, but it's really toxic, and we often leave people with really long-term side effects afterwards. So there were 2 abstracts at ASCO this year that looked at treatment deintensification, trying to give less treatment for lower risk nasopharynx cancer. One of them used radiation therapy alone without chemotherapy. The other one used a lower dose of radiation in combination with chemo, and both looked just as good as the more standard treatment regimen. So I think it was some pretty promising data to suggest that, if we select people carefully, if we identify those that are at low risk for disease recurrence, we may be able to get away with giving them less treatment and therefore less side effects. So not all that relevant to many of the patients that I see in my clinic, but I think important data.
Yeah, I couldn't agree more. And I think often in oncology, we're trying to add more treatments. So it was really nice to see the deintensification. And I was particularly interested in that intermediate risk trial that showed that radiation therapy may be just as good as chemoradiation therapy and definitely less toxic to our patients, which is always very important. So yeah, I think the field is really exciting. I also think it's complicated and there's so much new data. And one of the biggest questions I have moving forward is just what's the right sequence of therapies, whether we do chemo first or we do chemo after chemoradiation therapy. And so hopefully looking forward to some clarity on that in the future. And then as any good medical oncologist would say, hopefully we'll see some studies with immunotherapy in the curative setting as well for nasopharynx cancer. And it certainly showed some promise in the metastatic setting. So anything else, Dr. Gold, that you wanted to add?
I agree with you. I think it'll be interesting to see how immunotherapy makes its way earlier into treatment.
Yeah,